Hello. Today we'll be talking about care of the patient with vascular problems in Chapter 33. With this being said, we'll be looking at hypertension, atherosclerosis, arterial sclerosis, peripheral vascular disease, varicose veins, including hemorrhoids. And notice with hemorrhoids that the page numbers are 1127 to 1129. Today we'll be looking at collaborating with the interdisciplinary team, prioritizing the care for patients with vascular problems, teaching patients about lifestyle modifications, teaching about their medications, looking at nursing interventions to promote perfusion and to prevent complications such as clotting. We're going to look at assessment data, including labs and signs and symptoms. We're going to look at nursing interventions as well. Hypertension is the most common health problem seen in primary care settings. Both the American Heart Association and the American College of Cardiology recommend that all people keep a blood pressure below 130/80. And if they have not met this goal, then they need to have both be treated with drug therapy and with lifestyle modifications. Again, hypertension is a worldwide pandemic. It is noted that the 8th Joint National Committee's blood pressure numbers are different than those of the American Cardiology Association and the American Heart Association. With that being said, most hospital systems today use the ACC and the AHA parameters. As a review, remember that primary or essential hypertension is hypertension that is not related to a disease process. On the other hand, secondary hypertension is related to a disease process, such as kidney disease, Cushing's disease, or it could be related to medications such as estrogen or glucosteroids. Please make sure you take a look at the table 33.2 on page 700. Control of hypertension has consistently decreased the amount of cardiovascular morbidities and mortalities here in the United States, and was a main initiative of Healthy People 2020 and remains an initiative of Healthy People 2030, or is projected to be. And you see there are some of the health maintenance recommendations to encourage persons to lower their blood pressure, including a low sodium diet, restricting their sugars, aerobic activity, limiting alcohol intake, avoiding smoking and caffeine, reducing your weight and getting to an ideal BMI, and taking the recommended medications. When we're looking at our patient and getting an assessment history on our patient, or health history on our patient, we need to realize and look at the incidence and prevalence of hypertension is related to race. You have a higher percentage of African Americans in the United States than Euro Americans have a higher risk of hypertension earlier in life, making it much more likely to die from strokes or heart disease. This is well listed in the QSIN on page 700. Another interesting prevalence is when you look at age. A higher percentage of men have hypertension until the age of 45. Then it kind of evens out from 45 to 64, where men and women are equal. And then at age 64, it seems to be that women tend to have higher risk for hypertension. What are some other things that might cause someone to have hypertension? Well, obesity, sedentary lifestyle, high fat content diets. All of these are things that will increase someone's blood pressure. So we want to make sure when we're doing a health history on a patient that we're looking not only at their dietary habits and history of disease, but we also want to be able to look at their age and race and where they are with their lifestyle choices. Will also make a difference when doing your health history. The lifestyle changes are nicely listed for you on page 702. What I want you to realize is that when you tell someone they have hypertension and then you give them this list of things they need to do to improve their health, you have to realize that that's a large list. So what I will always encourage patients is to take it one day at a time. If you are used to a sedentary lifestyle, start walking to the mailbox. Start taking short walks around the block and increase your activity slowly. An interesting fact here is where it talks about decreasing alcohol consumption. It is recommended that no more than 1 alcoholic drink per day for women and 2 per day for men. And of course, with any lifestyle choices, we're going to want to stop smoking and use of tobacco. We're now going to look at medications. Common examples of drug therapy are listed on page 703. I'm going to take some time to now look at some of the more common medications. I'm not going to go through everything. This should be a review for those of you who are in the traditional 491, and Mr. DeFreitas will go over it more clearly for those of you in the accelerated track. Diuretics are the first type of drugs used for the management of hypertension. Thiazides are one of the most common used. When you look at thiazide diuretics, what we need to be aware of as nurses is that they are not without side effects and without some side effects that are undesirable. So patient education on the need to take your medication becomes imperative when using thiazide diuretics. They may decrease the libido in males. You also want to make sure that they're monitoring for hyponatremia. Also, if the patient is diabetic, we have to use thiazide diuretics with caution because it can interfere with serum glucose control as well. Patient education that will help with compliance with diuretics is making sure that patients take their diuretic early in the morning, because sometimes the frequent voiding can impair their daily activities. So you want to make sure they're taking it in the morning so that they're not getting up all night to go to the restroom. Before we move on off of diuretics, I do want to make sure that you're looking at the QSIN alerts on page 702 and 703. One of the important nursing interventions when looking at ACE inhibitors is the most frequent side effect is a dry, hacky cough. And you want to make sure that the patient does report this dry, hacking cough to their provider, because this, again, could be a reason for noncompliance. And it is easily changed to a different medication, and the medication is discontinued if this dry, hacky cough occurs. So you want to make sure that the patient is aware that it is a side effect and that there are other medications that can be used if this occurs with them. Angiotensin II receptor blockers are often used as the replacement medication when someone does have that dry, hacky cough from the ACE inhibitors. So this one is a common medication used for those patients. You want to make sure that you're monitoring for hyperkalemia, and again, warn the patients about getting up slowly because they are at risk of orthostatic hypertension. With your beta blockers, you're going to want to make sure that you're assessing both heart rate and blood pressure before administration, because it can cause a decrease in heart rate and cardiac output by suppression of the resin activity. You would not administer a beta blocker if the heart rate was less than or equal to 50 to 60, depending on your institution, or if your patient was symptomatic, and you would hold for systolics between 90 and 100. You also want to make sure that you're informing patients about other side effects of this medication, including fatigue, depression, and sexual dysfunction. Again, because there are different medications that can be used, we want to make sure that the patient is compliant with their medication. And if they're experiencing fatigue and depression or sexual dysfunction, they may not be as readily compliant with their medication regimen. A big thing with calcium channel blockers is no grapefruit juice or grapefruit juices with these medications. And that is because the use of grapefruit juice with your calcium channel blocker can enhance the action of the drug, causing organ dysfunction or death. Hypertensive crisis is something that you'll talk about more next semester. But I want you to be aware of what the blood pressure range is, which is greater than 180/120. With severe elevations in blood pressure, you can have organ damage. These patients are usually in a critical care unit to receive IV antihypertensive therapy. But do just take a quick look over the best practices on page 705. Mainly, I want you to be able to look at what you would assess for. Not only is their blood pressure elevated, they generally sometimes will have a severe headache. They may be dizzy. They could complain of blurred vision, shortness of breath. You may see nosebleeds. They may be anxious. So it's one of those things, even though we're dealing more with the chronic illness, you may be taking care of a patient who is in with something totally unrelated to their hypertension, but they've received bad news or something with their procedure that they had done has affected their blood pressure. And now we're in a hypertensive crisis. So being able to assess our patient and realize that they are in a hypertensive crisis and call that rapid response team to aid in their care is going to be essential for those of us working on med-surg units. We've really already talked a lot about hypertension and the health promotion for it. Big things I want you to really push forward with your patients is if the antihypertensive that their provider has prescribed for them is causing them to have adverse reactions or side effects, such as sexual dysfunction, nagging cough, any of those, it is imperative that they continue taking their medication. And with that being said, there are so many other medications that can be tried that will continue to normalize their blood pressure without causing the adverse reactions that they are experiencing. You also want to make sure that they do not stop their medications once their blood pressure normalizes. You want to make sure that they are stopping smoking, reducing their alcohol, increasing their activity. We've already talked about all of that. But what I want to really push home is that if they are having adverse reactions from medications, that they talk to their provider to get on a medication that is not causing these adverse reactions and not just stop taking the medication completely.